2.5 months from now, this country will embark on its largest healthcare coverage shift since Medicare and Medicaid were enacted in the 1960s. On October 1st, Americans can start to sign up for insurance options in the health exchanges as part of the Affordable Care Act. But the question is, will Wisconsin be ready? News 3 investigative reporter Adam Schrager asked that very question to some of the state's healthcare leaders this morning. Adam?
Michelle, it's a really tight timeline right now for a lot of people. Nothing's going to change when the Affordable Care Act goes fully into effect in January. But for people who work for small employers or those who don't have insurance right now, it could be a dramatic change. That's roughly 600,000 people at least that we're talking about here in Wisconsin. The ticket to Tuesday's health insurance conference may have been the hardest to get in Wisconsin today, besides getting in to see Paul McCartney at Miller Park.
Given that there's a lot of confusion out there, there's also a lot of insecurity.
Donna Friedsom helped bring 300 professionals to Madison's Crowne Plaza hotel to discuss how Wisconsin will implement the Affordable Care Act. She had a long wait list she had to turn away.
Right now, the effort is to clear up the misconceptions out there, let people understand what their insurance opportunities are, try to ease some of the concerns.
We're going to ensure as smooth a transition as we possibly can.
Brett Davis runs Wisconsin's Medicaid program. He knows if the providers are confused, the consumers will be as well.
Signing up for health insurance can be a confusing process, but there's a lot of great people throughout the state that will assist people in that transition overall.
The focus is no longer on the political aspects of health insurance reform, but instead on the operational and functional ones.
What we anticipate happening is some people are going to move on to the Medicaid rolls, some people are going to move off of Medicaid, some people are going to move into the private exchange market, and so what we're trying to do is to support all of those transitions that our patients will be making. At the same time, we're trying to support education in the community to make sure that everybody who lives in our area understands their new options that they'll have under this, and that's a big task.
A big task embraced by this big crowd that's unified in sending this message to Wisconsin.
We will be ready. We absolutely will be ready.
There remain many unknowns still at the federal level about how this will all be rolled out. For example, Wisconsin healthcare providers won't find out if they've been accepted to sell insurance on the exchange until September 1st. That's just a month before the enrollment begins. When that does happen, people can find out the prices and sign up through the State Department of Health Services website, but that too still needs to be set up. A lot more meetings to come, Michelle.
Sure.
That's what we've been told. A lot of people working on this nonstop.
Yeah, well, they said they'll be ready, so hopefully
That's
they
what
will.
they say.
Thanks, Adam.
Thank you.